What is the best facelift technique? This is actually a debate, and you will get different answers from different surgeons. There are a lot of different facelift techniques. There is the SMAS facelift, there is the deep plane facelift, there is the extended deep plane, there's a composite facelift. There's so many different ways to do this and different ways to get really good results. So it depends on that surgeon and the way that they can get very good results with you and with your anatomy. So it's worth a consultation with a facial plastic surgeon to talk about what you look like, what your goals are, and which technique is going to get you your best result. What is a SMAS facelift? SMAS facelift is where you take the fibrous layer that is between the skin and then the deeper structures of the parotid gland and things like that. And this is a very thin layer. You elevate the skin over this layer, and then you take the mobile part of this layer and re-suspend that back where it was. You can use different types of sutures to do this, and it's almost like straightening sheets on a bed to make that nice and tight and smooth and the way that it used to look. What is a full facelift? This always makes me laugh a little bit because I think the way that this was named doesn't make a lot of sense, and there's so many different names for facelifts that it shows that it's really kind of confusing. A full facelift really means your cheeks, your jawline, and your neck. Most people think full face, they think entire face, which means brows, cheeks, jawline. But a brow lift is a separate technique than a facelift. Brow lift lifts obviously the brows, and the facelift lifts your cheeks, your jawline, and your neck. That is what would be a full facelift: cheeks, jawline, and neck. What is a mid-facelift? So when we talk about the mid-face, that's this part right here. So that's basically your cheeks. So your cheeks, these nasolabial folds, marionette lines, and a little bit of the jowling. So when you have a mid-facelift, it's lifting this middle part of the face. What is a mini facelift? A mini facelift is an abbreviated version of the facelift, lifting just the cheeks, the nasolabial folds, the marionette lines, and tends to have a shorter incision going in the hair, around the ear and the ear canal, and just around the earlobe. This lifts just this mid portion of the face and tends to have less downtime than a full facelift. What is the best alternative to a facelift? There are a lot of different alternatives depending on what you're looking for. The fastest and easiest is a liquid facelift, meaning using injections with fillers like Restylane, Juvederm, Restylane Lift, Voluma to contour the face, to give more of the illusion of an oval-shaped face, to fill in the nasolabial folds and the marionette lines, and give a more rejuvenated look to the face. This is something that can be done in the office just with topical anesthesia and be done in 15 minutes. Other options include skin lifting technologies with ultrasound, radiofrequency, microneedling with radiofrequency that tend to lift skin better than anything. So if it's just a little bit of extra skin, those tend to work well. Or if you have a little bit heavier neck or heavier jowls, things like minimally invasive procedures like a face tight or a Nuvion tend to be a good alternative to a facelift. Have questions? Schedule a consultation anytime. I help people like you every day. Thanks for watching.